Hello viewers, welcome to my channel. First, have a look at this patient. This is 3 weeks postoperative follow-up after myringotomy and ventilation tube insertion at right ear. The patient was suffering from recurrent acute otitis media. So today I am going to talk about ventilation tube. Ventilation tube is also known as myringotomy tube, tympanostomy tube, or pressure equalization tube. A ventilation tube can be made of silicone, Teflon, titanium, or gold, and it is sometimes coated with aluminum oxide. If we classify ventilation tube, it can be classified into dumbbell-shaped, that is called Grommet, and T-shaped, that is called T-tube. The dumbbell-shaped Grommet are of different kinds like Shepherd tube, Armstrong tube, Shah tube, and Donaldson Grommet tube. The grommets that are the dumbbell-shaped ventilation tube are for short-term use. They are extruded in 6 to 9 months. But the T-shaped T-tube is for long-term use, and it is perfect for patients requiring ventilation tube for 1 to 2 years. So according to duration, the ventilation tube can also be classified into short-term ventilation tube and long-term ventilation tube. So now, what are the indications for insertion of grommet after myringotomy? The indications are recurrent or persistent otitis media with effusion, recurrent acute otitis media, eustachian tube dysfunction, and in some patients, those who are going to undergo hyperbaric oxygen therapy but cannot maintain the pressure. In these cases, also ventilation tube is inserted after doing myringotomy. So what does this ventilation tube do? They aerate the middle ear, they cause proper drainage of the middle ear, and they bypass the function of the eustachian tube. Now, what is the site of insertion of ventilation tube? Actually, the anteroinferior site of the tympanic membrane is preferred for myringotomy and grommet insertion. It can also be done posterior-inferiorly, but in case of posterior-inferior insertion, the extrusion rate is more than the antero-inferior insertion. That is, the antero-inferior insertion is more durable than the posterior-inferior insertion. Posterior superior insertion is never recommended because it can damage ossicular chain, and we use a special instrument for myringotomy, which is known as myringotome. Actually, to be perfect, it is Politzer myringotome. Politzer myringotome. Here. This is Politzer myringotome, which is used for myringotomy purpose. So what are the complications of this surgery? During surgery, the ventilation tube can shift into the middle ear, which is very rare, can occur in 0.5% of cases, and there may be ossicular chain disruption or ossicular chain damage in case of posterior superior insertion. In some cases, high jugular valve may be damaged if the ventilation tube is inserted too low. And postoperatively, there may be mild pain, there may be infection around the tube, there may be otorrhea, permanent tympanic membrane perforation, tympanosclerosis, perstance atrophy. These are the complications of ventilation tube insertion. So what is the postoperative care? Postoperatively, there may be mild pain for which paracetamol will be sufficient. There may be discharge for which topical antibiotic drop may be used for 3 to 5 days, and in some cases the tube may be blocked by the secretion, dried secretion or blood. In this case, steroid drop works well. And postoperatively, we will follow up the patient after 3 to 4 weeks. We can do hearing assessment, and we can also do otoscopic examination or otoendoscopic examination to see the condition of the tympanic membrane, position of the tube, and if there is any complication. So what is the hearing outcome after ventilation tube insertion? From a study, it has been shown that there is hearing gain of around 9 decibel at 6 months and 6 decibel at 12 months, 4 decibel at 24 months. And there is additional 3 to 4 decibel of hearing gain in case of adenoidectomy, which is performed in child patient if the condition demands. So that's all from ventilation tube. I hope it was useful for you. Thank you for watching. Goodbye.